give a brief introduction to Dr. Jakar. He's a consultant psychiatrist at the Department of Mental Health and Behavioral Sciences, Fortis Healthcare. And he completed his MBBS from Government Medical College and MD in Psychiatry from the reputed NIMHANS, National Institute of Mental Health and Neurosciences in Bangalore, and GB Pant Hospital in Delhi. He strongly believes in practicing evidence-based psychiatry and having a very holistic approach based on the specific needs of every individual, both pharmacological and non-pharmacological management, and individually tailoring options and solutions and interventions for individuals. He's also got a lot of expertise in neuromodulation treatment like TMS and yoga in psychiatry disorders. He's widely published in national and international journals and was also awarded the fellowship for the World Psychiatry Conference in Melbourne and Portugal, and Early Career Psychiatrist Fellowship Award at the World Social Psychiatry Conference in 2021. I'd also like to introduce Archana. Archana Sharma is the founder of Samvedna Senior Care, and she'll be moderating the discussion along with me. So really looking forward to having a very engaging discussion. And before we start to discuss this really important topic, I'd just like to mention to all the participants who've joined us that this is really going to be a conversation. So you're more than welcome to type in your questions into the chat so that we can address those. The meeting is being recorded and live streamed on our YouTube channel. So if you're comfortable, please feel free to type in your questions on the chat directly to the hosts or to myself or Dr. Jakar. Or you can also do this anonymously. And please do let others know that this recording will be available. So in case there are friends or family members who've not been able to watch this and join us today, they can look at this later on. So with that, I'd really like to turn to Dr. Jakar and perhaps begin with something that a lot of people struggle with. How do I know when I'm actually experiencing something that's mental health challenge? What do we mean by mental health?
So I think so. First of all, a happy and mental health day, and as well as the month. And hopefully, with this frame that we shouldn't celebrate only on these days, it should be more a part of our day-to-day activities. That as we take care of other part of our life, we should also be more responsible towards our mental health. So when we talk about mental health, is that we have to see a broader spectrum. That not only about illness when we talk, it's also about the wellness. Even to state this mental basically it's a state of wellness. So it's not a state of illness, it's more a state of wellness. We talk about state of well-being. And any human being, that includes you, that includes all of us who have been here, we often go through the challenges, we often go through the difficulties, but that difficulty doesn't define that we are just 1 minute. Say, auto. So that difficulty doesn't define that all of us we are suffering from mental illness. Mental is more type of a clinically diagnosed condition. So when we talk about mental well-being, we basically speak about 4 components. So at first, that it's that our ability to cope up with day-to-day stress. All of us we go through our challenges, all of us we go through our distress, but how we bounce back, how we cope up with it and make our life functional, that is first part. Second, that how productive we are. So consider that if you are a psychologist or if I'm a doctor or if the other person, they are part of administrative thing, or there are students who basically expected them to go and study and work. So everyone have a defined goal with regard to the personal and professional. So how potentially or how in a day-to-day basis we are coping up with it, and how we are putting that things into day-to-day scenario. Third, with all these difficulties, how basically we can contribute to the society. So my role is that, okay, I have to see patients or I have to help the patients in need. So by how we can make sure that I am just following this thing, and I'm just becoming a part of it. And somehow I'm able to take care of the things, my things, and as well as my family things. So this basically we talk about mental well-being. And when we talk about mental illness is more type of a clinical construct. It's a diagnosable condition where we basically, whatever we have read and whatever we have basically studied in the clinically population or in the epidemiological study, based on that construct, we have get the diagnostic criteria and we follow that criteria. So when we talk about the diagnosis, we are going to label with people with the defined illness and this thing. When we talk about it, it is making them dysfunctional. It is basically making them impairment with regard to their personal life, with regard to their social life, or with regard to their occupational life. So anything which basically started putting us into dysfunctionality, anything which basically started interfering in our day-to-day life, and which basically stays for some period of time. It shouldn't be this way that, okay, consider today I failed, and maybe for the next few days, it's a natural human response to feel down and to feel low for some period of time. So it have to be diagnosable, it have to be significantly dysfunctional, and it have to be severe enough for some period of time to somehow tag it as a part of a clinically diagnosable spectrum. Yeah.
Thank you, Dr. Jakar. And I think you really highlighted the differences between two things that are quite important. One is good mental health and the other is mental illness. And these are really two different things. Mental health is something we definitely all should strive for. Mental illness is when this begins to impact our day-to-day functioning in some way. And you've outlined the various areas where this could happen. And that's really, really important. So thank you for making that really important distinction. And I think it's really up to every individual to take care of their own mental health and well-being, as you were mentioning. This is something that we all need to take care of. And I think Archana will be talking a bit more about that later on, and some of Samvedna's efforts to help people with this. But maybe I could just ask you something else before I move on to hand over the discussion to Archana. What do you really see as being the pillars of good mental health?
Okay, so when we talk about good mental health, so we talk about the multitude of things which is happening around. So there are many things which basically support us, which basically builds our resilience towards a good mental health. So and it have to be longitudinal process. It can't be that, okay, if just to give an example. So consider when we discuss about physical health, and when basically we try to glorify our physical health, okay, we take keto diet, or we basically go for Botox injection, or we go for six-pack gym. It doesn't happen over a period of time. It doesn't happen that, okay, today we started and tomorrow we are going to build up. So it's a longitudinal perspective. And when we talk about a good mental health, it means that we have to make sure that we work on day-to-day difficulties, and somehow if you feel so that we are unable to get out of it by itself, taking the help of our loved ones, be in touch with the people. Just 1 minute, it's automatic, so it switch off after if there is no movement. Yeah. So we do have to make sure that when we talk about good mental health, it doesn't going to come out in a period of 1 week or 1 month. It's a longitudinal process. It's basically defined that you are working towards a better phase of yourself. You are working towards a betterment of your own individuality, and you're looking forward to change whatever the difficulties you have been facing. So in that, I think so there are many things which make sure that we should work on collectively or multiple things. One, that is good self-care. When we talk about self-care, it's not a luxury. It's a prerequisite of having a good mental health. So many times we sometimes ignore this concept of that. What if people start making us feeling guilty, or they will start tagging us with the concept of selfishness. So these are not these. Basically, when you take care of yourself, you somehow own that responsibility, that you give some self-respect to yourself. So taking care of your self-care with a good physical activity, with a good lifestyle, taking care of good actual day-to-day schedule. Sometimes we find it so difficult that if we are lying down on a bed for a few period of days, and if you don't structure our day, so a good routine, a good sleep, a good physical activity, all these things are basically somehow balance our biological part. Now come to the social part, because we are animals. In one way, Aristotle have said that man is a social animal, and we thrive in society, we live in society, we basically depends on for our livelihood into the society. So when we talk about the social connect, it basically means that we have to stay as a unit in the society, and there is some social rhythm in the society. So consider that if even have to interact with the neighbor, there is some norms and boundaries, and there are some undefined things. So when we interact in this thing, we feel connected with the people around us. So we do have to make sure that at least we build up one or two good, strong support network around us. That need not to be a family member. That can be any one or two loved ones. Where basically, whenever we feel down, we can somehow get at least, okay, there is somebody where we can go and we can look forward and we can seek some help. So make sure that we build up a good social support network around that. Good social support network doesn't mean that we need 20 people. We basically need at least one or two people with whom we can be comfortable enough to share any distress. So there shouldn't be any boundaries when we talk about these things, so that it's like a more type of a ventilation to the other person, where in day-to-day life, how we basically. Third thing is, I think so, apart from this, whenever we face any difficulties with regard to our professional stuff, or with regard to our interpersonal interaction, it's always good to communicate your distress. Sometimes what happens that we make our boundaries so flexible that it started impacting our emotional, our time space, our physical space. So we do have to make sure that we do have to respect our boundaries. It's a psychological demarcation where basically we give respect to ourselves, and also we somehow respect the other person also. So making care of that boundaries, that okay, just an example, consider that we have fixed this appointment at 6 o'clock. So we have taken care of the time boundaries of each other, so that neither it comes into my space of my OPD consultation, and it also should be comfortable. So this type of this thing, boundaries, limitation, taking care of your good physical health status, taking care of your social connectedness, taking care of your adverse circumstances, and how you cope up with the help of your self-care. I think all these things become equally an important part of a good mental health, and they represent the pillar of having a good mental health.
I mean, I completely agree with you, and I think you've highlighted some really important aspects. These are things that we tend to forget and ignore. Really important things, like you mentioned some very practical tips as well. Something like, trying to follow routine, regular sleep. You talked about the importance of a social network and how it doesn't really have to be, a large network, but it just has to be a close couple of people with whom you feel very comfortable. And very importantly, thank you for highlighting the importance of boundaries and being assertive enough to create those boundaries, because I think sometimes that is really one of the things that leads to a lot of pressure on individuals. And it's really important to become aware of where we need to draw those boundaries for our um, for our good and better mental health. So thank you for outlining these really, really important aspects. Um, Archana, maybe I could just hand over to you, and for the next couple of questions, and just to remind our participants in the audience that you're welcome to share questions in the chat box that we can put across to Dr. Jitendra, and he'd be very happy to respond to those questions. So please do go ahead and share your questions. Thank you.
Yeah. Thank you, Jayashree, and thank you, Dr. Jakar, for joining us today. Samvedna has always been at the forefront of mental health for older adults, and our team is, has a very qualified and expert psychologists. We follow a very clinical approach to the whole mental health, solutions which we provide. See, today, this year's Mental Health Day is marked as how do we make it a global priority, right? So this is the theme for this year. So I wanted to ask you, maybe you can share your thoughts on how, as a community, as a society, and especially in a country like India, where, mental health is not spoken of. Only, I think, during the pandemic, a little bit of conversation has come to the forefront. How can we make it a priority in different social forums, whether it's work, family unit. Let's start with the family, with the work units, with society at large. What are your thoughts on this?
So, like, it's more about that how we want to put things into action. We talk about it, but in our day-to-day scenario, in our day-to-day interactions, how we can make it more impactful. So when we talk about this thing, that putting thing into action, or when how we can make it as a more a part of a day-to-day, what we forget is that we don't know that what exactly is going through the other person mind. So maybe we, all of us, we people who are attending, we are smiling, we are somehow keeping ourselves sane, right? We somehow basically not letting out our whatever the deep inside emotions into the face. So we are covering up our things which is there deep inside. So we don't know what exactly goes through the other person mind. So first of all, I think so what we can be sure is that at least be non-judgmental and be considerate about other persons. I know these are difficult things to be, but I sometimes we also forget to follow. But make sure that whenever you react to somebody, they also go through their own difficulties, their own emotional turmoils. So let be more less judgmental about other people. Let's be less reactive towards them. If you anytime feel so that okay, that you are annoyed by something, communicate in a softer voice, communicate in a more communicable pattern rather than like there are different ways to set the same thing. You can be more dignified. You can be more dignified in a way how you communicate your this thing. Like consider, I can say that okay, what nonsense you are doing. Other way of telling that okay, can we do it in a better way? So both the things communicate the same, and both that we are unhappy with the end result, but we communicate in a more dignified way. So one thing is that, and second thing is that how often recently, in fact, if you'll ask me, Deepika Padukone have given one interview, and I don't know it was recent or this thing, but it came into this thing nowadays because it's a mental health day. So she told that when she was experiencing the difficult time in her life, we always take example from the people who have been good or professionally have done good in their life. So what she have told that when she have expressed all these concerns to her mother, that is her caregiver, she was the first person, she was the first support she got it, and see the transformation. If at that time, being a caregiver, if she would refuse, if she would have rejected it, if she would have asked her to refrain from speaking about herself, things could have been totally different from with her. So being a caregiver, it's equally important to understand that we want to love other person, but that love also means that taking care of that person. It shouldn't be only that it should over involvement. It shouldn't be always that okay, we just pass it on to the other person that you do this thing, then only we are going to reciprocate. Sometimes it's equally important for the caregiver is that respect the right of other person. Just see what difficult time they are going through. Be supportive towards them. And if anytime you feel so, because you have seen them over a period of time, that person is struggling with regard to a mental health issue, he have taken lots of guts to express in front of her, because it's not something, this is very personal. We won't be vocal even to our parents, even to our friends, until unless we are not in a distress. They would have suffered in silence from such a long period of time that now it's become so difficult for them to open out. But finally, if they opened out, so they have that faith in you. They have somehow made that connection and that trust relationship with you. So don't broke that trust relationship. Be around them. And if you anytime feel so that being a caregiver, that it is beyond your limits, make sure that you connect them with somebody who is more professional and who is more experienced in this thing. Because they see every person in an individualistic way, and they have their own non-judgmental way of seeing the things, how transparent and how difficult it is for them. So being a part of that family members and being a part of your own these things I think so makes it very important, so that in a day-to-day life we can be more receptive about our persons who basically express distress, who express the difficulties, and be more accommodative with regard to our day-to-day living within our family groups or with regard to our friends group.
नहीं, आपने बहुत अच्छा बोला डॉक्टर साहब. एंड एक्चुअली मुझे एक मीम मैंने देखा था अभी 2-3 दिन पहले इंस्टाग्राम पे. So it was basically saying that a young chap was saying कि मुझे depression हो रहा है, तो उसकी mother कहती है middle class में depression नहीं हो सकता. So that is, and then there was a joke. It was a small, half 30-second reel, but that's how typically families will either put it under the carpet, or they will say, it's a part of our destiny. We have to endure things because, of XYZ reasons. But I think, being I'm to say a supportive family, what I understood from your this thing, a supportive family, not being judgmental, and being empathetic is very key to encouraging people to speak about mental health. And we never know what's going on the other side and what they are going through. So I think if we just put that in our mind and keep that in the back of the mind, things could be we could make a small impact in this regard.
Just to add one thing, as like this thing, that how many of us have taken a mental health leave?
Sorry?
Like we normally say that we are not feeling well. Okay, give us 2 days of medical leave.
Yes.
Give us 1 week of this thing. But how open we are to discussing and letting people know that, okay, give me maybe mental health leave for 2 days or 3 days. So the change should begin within ourselves. Yes. Because until unless if we are not comfortable in that phase, that okay, we also can go through the down phase, we can also go through the distress, and somehow breaking that stigma around it. It's okay to take mental health leave. It's okay to feel down. It's okay to have a problematic days of your this thing. Nobody is going to judge you based on your 1 day or one bad phase or one negative event of your life. So your life is a longitudinal journey. So one or two down phase of your life is not going to determine what is your end point. So just I think so little bit making ourselves also more open to this type of communications and can be more helpful.
Right. Which actually brings me to the other question, and I think there's already a couple of questions around this, something related to migraine, that, how does mental health struggle manifest physically? Because I think there is a very, I feel that there's a strong relation between physical and mental health. And what is your take on this? There's a question also here, how is migraine related to depressive symptoms, chronic pains, and,
So first of all, I think so that mind and body are interlinked. They doesn't make part of two individuals. They comes in the same individual. So if I have pain, it is going to manifest in our emotion, and if I have emotional difficulty, it is going to manifest in the form of a bodily symptom. In fact, when we talk about mental health illness, if I just broadly classify them, they have 4 components to involve. One is emotional component, where patient express the emotion, that is they can feel down, they can feel low, they can have guilt, or they can feel anxious. Second is the physical component, where they basically talk about the somatic symptoms. They can have a loss of appetite, they can have multiple body pain which are not explained organically, they can have decreased appetite, they can have libido, they can have a feeling of very tiredness or weight loss, or nowadays specifically due to the anxiety, that bowel difficulties or IBS type of a presentation, or multiple body pain, non-migratory pain. Third is the cognitive, where they can have difficulty in processing, in the memory, in the attention, in comprehending things, difficulty to grasp the understanding of the structures, difficulty in attention or complex activity, and so physical, emotional, and cognitive. And third is the social part. Social basically where they find it difficult with interpersonal social interaction. So it's bi-directional. So mental health issue can lead to the physical symptom, and physical symptoms also can lead to the example, if somebody have a heart issue or somebody have gone through a stroke, so it can manifest in the form of a depressive or anxiety state, because it's something has happened for the first time, and in order to cope up or to adjust to the change in the physical health status, it may manifest in the form of a emotional symptoms, which can be feeling of how it has happened, feeling of down, feeling of anxious. So all these things are interlinked. And one more thing to add, like now somebody asked me, like many times people come with a presentation of headache and specifically migraine. So there are 2-3 things. Like if you'll ask me the hypothetically, what can be one of the pathway? If somebody is stressed out for a longer, leads to buildup of muscle tension. If muscle tension build up, then it leads to anaerobic production. Anaerobic production increases the lactic acid, which basically somehow sensitize our nerve and lead to the pain production. So this is one of the biological pathway. There are many other hypotheses that we become over sensitive, over selective attention, and we started misinterpreting the bodily unharmful stimulus, and through a sensory gating theories, we hyper process that information. So even when you are mentally not in a good space, it can manifest in the form of pain and in the form of a bodily symptoms.
Right. No, thank you for sharing that. And the other. So I'll just move on to some of the questions, because we have a lot of questions which are participants have already sent to us in advance as well. So I do want to take up some of that. And so coming back, to this, you talked about the caregiver, the supportive caregiver. So I think one of the things we deal with a lot and is how do we improve the mental wellness of a caregiver himself or herself? And that's a question which is coming for, and especially if, they're taking care of somebody with a long-term neurodegenerative disorder like, Parkinson's or dementia, or somebody, even if he's a caregiver to a mental health patient, right? So their health also suffers.
So one of the, maybe you can say that little bit of gray area of mental health is that caregiving can be sometimes very difficult. Because if you are caring for somebody who's having chronic mental illness, who is basically not responding well to the medication, it can be very difficult. Saying is difficult, but those who goes through that caring of that loved ones, neither they can delineate them from that person, neither they can basically express their emotional part of it. They can't be critical, they can't show their negative expressed emotion. So caring can be very difficult. Also, they have to other way taking care of that, how they struggle with this thing. So there are few things which basically we used to do in Nimans while and in the clinical practice also. So first of all, I think so we ask them to share the care load burden. That if there are three family members in the home, so make them equally responsible for divided work. So maybe morning hours somebody else can take care of the part, evening hours somebody else can take care of the part, or few work which are related to maybe taking care of the medical health, one person can take that responsibility, and maybe any exacerbation or any emergency situation the other partner can. It's not that they are part of a family unit only, so it's not a defined role, but at least they can presume some role that these difficulties happen, then one partner will be more responsible than the other family members. So somehow it decreases the phase of time, and this is proven like scientifically also. If you can decrease the phase of exposure to maybe 36 to 48 hours, then it decreases the caregiver burden. Second thing, what basically we done is that even for the caregiving, some sort of a physical activity or some sort of a respite time where basically they go and let's just go and do yoga for half an hour, 1 hour in a day, or go and meet your loved ones, take a break for 1 week, enjoy your time with your extended family members or with your friends, or even just take a break for some time. So it decreases the caregiver burden. So all these things basically become very important, because you don't want to put another person in the family also goes through their mental health difficulties. So in fact, this can be more a type of a preventive aspect, that if you know that somebody is struggling with a mental health issue for a long time and is unable to take care of his difficulties, so caregiver share load can be one of the good tool where basically we can prevent some other family members to go through their own difficulties.
Right. At Samvedna, we recommend them to have their me time,
Yeah.
So take time out for yourself, and I think it's just taking these breaks are very helpful, because that kind of refreshes you.
Me time is selfish time.
Yes.
And which basically undo they are putting the stress on themselves.
Right.
Selfishness is totally different than a personal space for ourselves.
Right.
So somehow respecting that time, respecting your individuality, respecting you as a person, that I also exist in this world as a individual, can be very.
Yes. Yes. So I think I just wanted to switch to the audience and just take a couple of questions from here as well. So there's a question: is depression a psychological phenomenon, or is it a biological disease?
Okay. So depression, when we talk about this thing, and this is a layman, what we basic is, we don't call depression. We call it a major depressive disorder. So it's so much of abused in this our day-to-day life that agar, like so many slang language, so many normal communication is it's not such an easy word. It's not such a normal word to use in our day-to-day skill. Consider that if you are going through a relationship failure, or if even if while falling you have gone through you met an accident. So, or if you are basically lost maybe 1,000, 2,000 based on different people. So, I'm feeling down, or I'm depressed too. So depression is totally a different construct as compared to this normally an abused word which you use in a day-to-day scenario.
Right.
Second thing is that okay, what question that person asked? Depression.
So the depression is a psychological phenomena, or is it a biological illness?
So when we talk about the etiology or predisposition, we normally follow a biopsychosocial approach. Okay, there is no one defined clear hypothesis. Like the perfect example for you that we were talking about, that depression happens due to serotonin deficiency or some neurotransmitter decreased level in corticospinal fluid, or because of the down regulation of receptors, which we normally talk through. We are talking, but now recently one network meta-analysis have come and they have told that no more serotonin can be a established causal association for depression. So it's not only about one part, it's basically more about the mixture of multiple things happening. Like, just to give an example, there is a stress diathesis model, okay, that everyone have a predisposition, everyone have their constitutional diathesis, everyone have some inherent latent state, and all of us are vulnerable, but we require an extra hit. That hit can be maybe psychological, that hit can be social, that hit can be economical, that hit can be any relationship failure. So you need a extra hit, and that uncovers your vulnerability. So it's a combination of biological factors where we talk about the genetic heritability, but it only increases the relative risk maybe by 5 times and 10 times. So it's not that every uh, parents who have depression, they are going to pass out the depression into their progeny. It's only basically indicate that they can be at a high risk, maybe 5 to 7 times more for the depression, around 10 times more for the substance abuse. But it's not the only independent risk factors. Apart from that, there are other risk factors, biological, social, environmental, situational, drug, substance. So all these things complicate, and together they predispose to a diagnosable clinical condition, which we call it a depression.
Thank you for sharing that, Doctor. So I'll just come to, I'm looking at some of the questions which are here in this chat. And I think there are a couple of questions around how do you approach your loved one who is probably going through a mental health issue, and how do you encourage them to take help? And I think there's another related question, then how much do you tolerate if somebody has, a bipolar or a psychological issue, how much of that, whatever they are saying as a family member, or as a care spouse or parent or whatever, how much of that behavior should you be taking in? And I think that's very relevant to the caregiver stress as well. So I think
So most important for a caregiver or for a family member or loved one is that see, those who are struggling, they will have emotional difficulties. So you will see somebody consider that who is going through depression. So sometimes he will be totally absorbed. Sometimes he will be reactive in the form of anger and irritability, or sometimes he will withdraw himself totally. He will disconnect. He won't pick up your call. He will stop going to the office. He will stop meeting his friends. So what happens that first of all, you have to normalize this thing that okay, rather than attributing it to the person that can say that okay, you are reacting, you are responding, you are getting irritability, somehow downplaying that part and understanding the other person that maybe it's not him or it's not her, it's the part of an illness. So this somehow will make ourselves more connected to that person, that it's not that person who is responding, it's the illness which basically reacting in that way. So first, that make sure that you understood that the person is going through a mental health issues and he is going to react in a emotionally reactive. So somehow decreasing your reaction to it can be one of the first part. Second is that they will sometimes find it very difficult to open up. So just one or two or approach is that okay. It normally happens that I try to talk to my friends, but I asked him how you've been feeling, and he said I'm feeling okay. So it have to be multiple times. It can't be just one way, or once you have asked that person, okay, how you've been feeling, because it's not a one time is experiencing this discomfort from so many months or so many years. So just be very regular, just to be more sticky to your friend. Ask on a multiple times. Don't be pushy that okay, you are always after them, but make also respecting the other person's space and also somehow putting them into that comfort zone that maybe okay, I'm around whenever you need me. I'm just one phone call away. I care for you. I know that you need your own time, but I'll be available whenever you need. What type of help I can do at this time? So in this way, you are just putting your suggestion to the other partner. You're not advising if you do this thing. You're just putting your thing. You are making that person feel comfortable, and no matter, there will be time when, because he needs help. So there will come one time when he'll open up. He will break that friction, and he will be more comfortable discussing. So just give that time, more opportunity to that person, less reactive to that person, emotional difficulties, and be more empathetic towards that person. I think so. If we stay in that phase, we will soon find out that other person will be more receptive.
Yeah, no, that's very nicely put. I think sometimes we tend to be very patronizing and we start advising individuals, which is, I think, which pushes the person back. And I think just leaving that signal with them that you are there for them to, hear them out and not giving them advice, unsolicited advice, is probably the best thing to do.
Yeah, advising never helps, because what worked well for you, you give advice based on your own personal experiences.
Right.
I had a difficult time in my life and I did this, but you are a different person from that. So how he is going to come out of it, how he is going to cope up with these difficulties, totally his own individual. So that might have worked well for you, but it might not work well for that person who is going through a distress. So let him explore what will work for him. You be just more supportive and empathetic towards that person.
Right. So, so I have a lot of questions from different professionals actually. So I have questions from teachers, from doctors, who are, asking questions about how do they take care of their mental health. Teachers are concerned about mental harassment from students. Doctors, you're probably the best person to take that up in terms of what is the kind of mental health issues they face. Would you like to say anything about this today, or?
So every profession have their challenges. Even if you are working as a security guard, you will have your own challenge that you have to stay awake whole night, or even if you are a part of a corporate sector where there will be too much of demand onto you, and there will be always some hard time commitments onto you, or even maybe you are in a medical professional where you have to deal with the life of another person. So every profession comes with the challenges, even with the vendor who have to daily make sure of his day-to-day expenses, daily wages. So every human being go through their difficulties. Every profession have their own challenges. What is important is that okay, just maybe let's have more realistic explanation. I also go through the difficult time. I also sometimes we are human being. We are bound to go through a difficult time. So what is my coping skills to is that whenever I feel it's difficult for me, I make sure that at the end of the week or at the end of the day, uh, I book a appointment. Well, I book an badminton court. I go and play there for 2 to 3 hours. I somehow feel relaxed after playing. It gives me a break from my monotonous OPD coming to going to this thing, and I feel a little bit more enthusiastic. So this is my mental toolkit. This is the way I feel more comfortable. Maybe if I still don't feel good, I might call some of my close friends who have been there in my life from last 5 to 10 years. I know this person is always emotionally available to me. I call and I express my discomfort. It's not that he's doing something different. He's not a doctor or he's not a professional, but that need that, okay, I have been heard enough, I have been listened enough by the other person. It gives you some sense of calmness. Okay, there is somebody. It gives that unconscious feeling of well-being. Okay, I have closed and loved people around me whom I can look forward. Or third thing is that maybe if nothing works, uh, I go for a yoga. Yoga sometimes become difficult now, but I go for a walk. So these things are very, these are very subtle things. Doesn't look okay. They are going to be give some dramatic response, but these are the things which basically connects you to your baseline. This basically connects you to your ground threshold for stress. So make sure that you keep on bouncing back on yourself, checking on yourself, and anytime you feel so that okay, these things are not in your control, seek help, seek the next available thing.
Mhm, mhm. Yeah, so I think this this brings me to this question, Dr. Thakur, that how can you analyze, whether you are going through a mental health issue? Like, what are the symptoms to watch out for? What are the signs? And how can I think it's like today we have spoken about the pillars of good mental health and the self-care aspect of it. So in terms of what are the early signs or early warning signs of when should you decide that you probably need to take help, whether with a counselor or with a psychiatrist, how would you define that?
So first of all, I think so even the thought of that, whenever the first thought came in your mind, that is there something wrong in me, or is there something where I need to work on, that itself is a good warning sign that okay, uh, things are now unmanageable, things are now beyond which normally used to be, and this is like a more type of alarming sign and red flag sign to yourself that okay, now there is something where I need to work on. So this is like more type of a self analysis. Secondly, that if you feel so that any of the stress which have been lingering on for a long period of time and which started affecting, like it affects your thought, emotions and behavior, and it started affecting your functioning. So functioning is one of the yardstick parameter through which you can assess. So consider that if you are a professional and it is expected from you to go and work in your office or work in your hospital, and somehow you're finding it difficult to even get up from the bed and to go to the hospital, to be there in that position, feeling very tired. So or in with regard to your personal relationship, that you are getting irritable on minor things. Nowadays the friction between the family members have increased because of your mood difficulties, and even people are sensing that you are getting angry or you're not socializing or you're internalizing your concerns. So all these things are basically giving us a direction that it is started affecting our personal, social and occupational domain, and which basically persists for a period of time. अगर एक दो हफ्ते 2-3 महीने तक if it is there, we know that it can be just a reactive form of to some stressful situation. But if you feel that it is lingering on for defined period of time. In depression, we normally call it is a 2 months, 2 weeks, although this is not a clear demarcation, but normally if it has persisted for 2 weeks, for anxiety, if it is persisted for 1 month, for a psychotic spectrum, if these things have persisted for a period of 1 month to 6 months. So based on this defined time duration and severity, it gives us some understanding that now things are not just a stressful reaction, it's something more than normal stressful situation.
Okay. I don't know if Jayashree, do you want to come in at this point and share any thoughts you may have? I think she's...
No, I think why don't we continue with any of the other questions that we have from the audience, because I think we only have a couple of minutes left, and I think we also want to talk about some of the endeavors that Samveda is making towards helping people actually take charge of their own mental health. A lot of things which you and Dr. Jitendra were already discussing. So maybe we could do that.
Sure. So, Dr. Thakur, what are your tips for enhancing mental health, and how can you be kind to your mind and yourself?
I think so. First of all, is that I think every one of us, we should establish our mental toolkit. And when we talk about mental toolkit, is that every individual is different. How I am going to cope up with it is totally different from how you are going to cope up with it. So I have some resources through which I can help myself. So I think so everyone should build up resources around them, and that resources can be anything. It can be social, it can be some physical, it can be just a part of involving into some other maybe skill-based activity like dancing, running, meeting friends, or just maybe having a trip for one day. So these are basically more type of a more mental your kid, how you cope up with the day-to-day stress. If you feel that that thing is crossed and now these things are not helping you, then second thing comes that seeking a help of a professional. If you are hesitant or reluctant about it, at least go and speak to somebody with whom, like with your loved ones. Don't keep it within yourself. So first, within yourself, what you can do. Second, seeking the care and need of your loved ones. If still it is not in your position, if you're still finding it difficult, then consulting somebody professional who basically have been managing these things, who basically somehow guide you. They are not going to judge you. They are not going to know your life better than yourself. But it's more about putting things into the tables and see. It's like more problem focused. It's more solution focused rather than the problem focused. And try to see what things might work well for you to come out of this stress.
Okay.
And just I'll add one more thing also, that being a psychiatrist, we often see people are reluctant to the medications. So I think so, we've been trying this thing, and those who basically feel better, like most of the time, even if I'll ask all the audiences that, okay, no, medications are addictive. Medications are just only sedating medication. Medications are only going to continue for the whole life. And so, and I won't tell you that people are somehow biased in that. They would have also gone through the day-to-day experiences, seeing other persons, seeing the neighborhood, or seeing this thing. But what they fail to understand, that key, when we prescribe you something, it's not that we are telling you that you have to take it for a lifetime. So if you'll ask me, consider that if a patient of depression have come to me, and the patient is severity, or if there are death wishes or there are harm to others, we know that these are clear indication where we basically now it's time for a medical intervention. So we often basically fail to circulate the positive stories. If you'll ask me, if I see 100 patients in a month of maybe say depression, 50% do gets better, and with the medication. And once they get better now, then only they see the change in themselves. Okay, I was unnecessarily getting apprehensive about the medications. I was unnecessarily worried about the medication. These medications are as safe like paracetamol. In fact, sometimes I'll feel so they are safer than any other medication. Right. So only thing is that they are not at all addictive. They are not at all going to make you sluggish. They are not at all going to make you groggy. They are not at all have any addictive potential. None of the medication in this world are meant for harm to human being. Medications are meant to have your better quality of life. They are meant to somehow increase your well-being. So they are also designed in such a way. So if you feel so that, okay, you had a poor experience with one of the physician, one of the psychiatrists, consult somebody else, but don't refrain yourself, because two doctors can also have different approach. So see what fits well for you. See what's basically make you feel comfortable. Only thing with basically I will advise is that out of all the psychotropics which we use, if you'll ask me, don't take benzodiazepine. It's not that you refrain yourself, but don't take unsupervised benzodiazepine like the normally. And in fact, this is the most abused medication. Maybe if you'll ask any one of your family members, somebody in your family, maybe your dadaji, papa, mama, somebody would have been taking benzodiazepine. And then they come, so okay, medications are addictive. If you are going to take those medications which have abuse potential, these are going to be addictive, and you are taking unsupervised. So you are responsible for your own thing. At that time, it's not that the doctors have advised you. So I think so. Anything which have been taken under supervision, even in fact with the benzodiazepine, they are as safe. So they have a plan. You when to give and when to stop. So during you give benzodiazepine only for acute management. So be very about your mental health. It can't be taken so lightly that okay, you self-prescribe yourself. You basically take it SOS. Mental health doesn't get better with SOS medication or with once or two consultation with a psychiatrist. It's a journey, and it's a journey for next 3 months to next 6 months where you want to see a better version of yourself. And if you want to see a better version of yourself, you need to work hard. Nothing comes with easy.
Right. Yeah. No, I think that's very well said. And I think there is a whole process to the whole mental health journey itself. And, at Samvedna, what we offer is, we offer assessments, clinical evaluations before we, then we recommend if you feel that there is a requirement to see a psychiatrist, or what can be resolved through counseling, or what is actually not in our purview, but is actually best treated by a doctor. So we provide these kind of assessments. And in fact, even before this, these psychological assessments, what Samvedna we have just launched recently is a self-screening tool, which I want to just share with everyone for a couple of minutes. And Jayashree, please feel free to come in whenever you would like to. So this tool is basically designed to encourage help-seeking behavior, and it's a decision-making tool, you could say, for an individual to assess his or her mental well-being. So we have multiple screenings. So we have screening for dementia, for caregiver stress, as well as for mental well-being. And once you go through a series of questions about different aspects of mental well-being, then you are you're directed, you're guided to a particular distinct direction, that whether you are at risk or you're doing well, or if there are significant responses there which indicate that you're showing issues of distress. So then we will will encourage the individual to take corrective steps. So for example, this is the kind of dashboard we are looking at, where we are indicating to the user what kind of concern they are showing. And then the individual we also offering a self-care plan, which we have talked so much about today, as to how they can they can have their favorite, they can track different wellness activities around the 8 dimensions of wellness. We are also asking them to track their sleep, as well as nutrition and other aspects. And so this is like the starting point. So these are, the self-care plan is really in the whole preventive space. And for somebody who is not at risk, this is what we recommend. And then if somebody is at risk or there are certain, like, this is a test data, so please don't read it any other way. But if somebody is, we find that he's at a potential threat, serious level, then we would recommend speaking to a counselor, understanding, what are the next steps, and the counselor would guide them through, taking detailed psychological evaluation, and then maybe if required, seeing a psychiatrist or a physician, as the case may be. So this is something which is available now at map.com, and I would encourage you to please go and try it out and see if this is something you would like to take. So I'll just type in the URL here, and Jayashree, you want to come in?
Yes, thank you, Archana. So I think one of the biggest challenges, hesitations that we've seen is that people are reluctant to take that first step to meet with a mental health professional, because there is a stigma, and we acknowledge that that stigma exists. And therefore, this tool is really putting a lot of power in the individual's hand, where they can actually start to begin thinking about their own mental health and their mental well-being, think about maybe areas that they might be struggling with, and see what they can do to help themselves. And also with some guidance around when we feel it is necessary for you to actually reach out to a professional. So it's really to help an individual take some of those really critical decisions. And as Dr. Jitendra was mentioning, there is a lot of hesitancy sometimes, to take medications. But I just want to mention that the most efficacy in terms of mental health treatment from the literature has been when there is a combination of medication where required and psychosocial interventions. So where it is necessary to take medication, it's absolutely important. It is a part of the intervention process, as Dr. Jitendra was mentioning. Mental health is really a journey. It's a process. It's not that you can meet with a professional one time and expect that things will get better overnight. So it is really a process. And as he was mentioning, if you've not had a good experience with one, mental health professional, that doesn't mean that you won't have a better experience with someone else. So, and that's your right. That's your, that is in your hands to. It is important for you to take care of your own mental health. So reach out to someone else if that's what's holding you back. We hope that that is not the kind of experience that you would have with professionals. But again, every person's experience is different. So it is very, very important to understand that you need to work with your mental health professional to see the best outcomes and results. It's not a top-down approach. It is not that the mental health professional will tell you what to do and it will change the challenges or experiences that you're struggling with. It is really about that process where you work together with the mental health professional to make about that change. So with that, I think I would just encourage everyone to really look at this tool, share it with anyone who you would like to share it with, and encourage others to also look at this, because as we've been discussing today, mental health is really a very important topic. It's a very important area, and it's something that we all deserve. We all need our mental well-being.
So just for the viewers, Dr. Jakar is available at Samvedna, with prior appointment. If anybody wants to book a consultation with him, he will also be available in our Anand Niketan clinic on certain days. Dr. Jakar, any parting thoughts on this wonderful discussion we had today, and commemorating World Mental Health Day? I hope we can recognize every day as a good mental health day and not just once a year. But your parting thoughts, sir?
Maybe I'll just say that I'll end up physical health add more years to your life. Maybe you will take care of your physical health, you will survive from 70 years to 80 years, 80 years to 90 years. But what adds years to your life or life to your years is your mental health. So it connects to your well-being. If you are not happy, if you are not satisfied in your life, if you are not contained in your life, then nothing matters. So take care of your mental health. If you feel so you are unable to take care by yourself, first help should be your loved one. If still it is not helping you out, then the second level of help should be the professional. Thank you.
Thank you very much, Dr. Jakar, for this wonderful discussion. And we hope, we try to take as many questions as possible, I think, but 1 hour is always never enough for this topic. And we hope the audience enjoyed this. Thank you, Jayashree, for coming in. I know you are not well today, and you are making a huge effort to stay, in this conversation. So this recording of this session will be available, and you can also watch it on our YouTube channel. We will be sharing a follow-up link and email of this. So watch out for that. And do write to us how you like the session, if there are any other topics you would like to cover, because we keep doing these kind of conversations from time to time. And we'll be very keen to hear your thoughts, and stay tuned till the next time. Thank you, Dr. Jakar, once again. Thank you so much.
Yeah, thank you to the team.
Thank you. Thank you.
Okay, take care.
Thank you. Thank you, everyone. Thank you.